Coming to this, the root canal therapy encompasses a sequence of procedure of aim, treatment of infected root canal, resulting in resolution of infection process and in prevention of microbial infection in inverted tooth. Definition: sealer radio opaque dental care. The cements used usually in combination with the solid or semi-solid core material of the regions. History: original zinc oxide in 1983, followed by 52 biosealers, 55. And they used the diacate sealer. 56 Grossman used zinc oxide formula, which is known as Grossman sealers formula. 80 and the Wilshire introduced plastic material. Hydron 61 Duke Seal introduced 65 Nyberg and Tula form. Cloperza N2 was introduced by Sangaretti. 76 Pitford recommended endodontic glass ionomer Ketak as a root canal sealers. Brown developed a calcium phosphate cement, FNE and get flow of the region. Ideal sealer. Grossman concept. According to the Grossman concept, it provides an excellent seal of the region. Should be radiopaque, non-staining, dimensionally stable. And the easily removed insoluble in tissue fluids. It should be bactericidal at least with the encourage of the bacterial coat, non-irritating to the period base, slow slating to ensure the sufficient working time. Function of sealers, which includes antimicrobial agents, binding agents as a lubricant and radio opacity. Future direction: penetrate the patient dental tubules, bind intimately to both organic and inorganic phase of the dentine, neutralize or destroy the microorganism and the products. Predictability: induce cemental regenerative responses over the apical foramen, strengthen the root system. Classification: usual, non-usual, medicated of the region. Usual: silver containing silver free cement, silver containing Kersealer Ricus 1931, Procil radio opaque silver cement, Procil non-17, Grossman sealer, tube sealer, and watch paste of the region. Non-usual: diacate AS26, Cloprezza, non-usual, hydron endophil glass ionomer, polycarboxylate, calcium, and the phosphate cement of the region. Medicated diakin A, N2, endomethazone, SPAD, iodoform paste, Rebus paste, Misonol paste, EaOH2 paste, Grossman zinc oxide resin cement, calcium hydroxide cement, paraformaldehyde cement, and paste. Cement paste, the plastics and experimental sealers according to Kogan type 1. Similar cells used with the core material and the powder and liquid and polyfine paste and paste and the non-polyfine polymer resin system. Filling metals are used without the core materials or sealer cements. Powder and liquid non-polymerizing paste and paste non-polymerizing metal and the absorbable sealer, Grossman sealer, Rotek and non-absorbable sealer, Diatec, Ketek, Index, AH26 and AH plus of the regions. Mm, Coming to zinc oxide eugenol based sealers, which is nothing but the common sealers. Advantage: excellent lubricating properties, allows working time more than 30 minutes, germicidal action, biocompatibility, greater bulk than any sealer, disadvantage extremely staining. Manipulations and which include powders in the pellet and liquid bottle system. Powder zinc oxide the 45%, precipitated silver 17%, hydrogenated the 36%, magnesium oxide 2%, usual 90, Canada plasma of the resin, zinc oxide 40%, stability resin 27, bismuth submodulated 15, barium sulfate 15, eugenol 80, sweat oil almost 20% of the resin, powder and the Grossman sealer. Role of and the each component which helps to improve the mixing characteristic and reduce the setting time. Sodium extend the setting time of the resin. Bismuth sulfonate, barium sulfate improves radio opacity. Advantage: it is most widely used. The sealer means most of the Grossman own requirements for ideal sealer cause minimal degree of irritation and high level of antimicrobial action. The sealer is excellent when lubrication is needed. Clean up nicely with xylene and other and the similar solvents. Formulation is non-staining. Tissue toxicity is about the same as that of EZ2E type sealers. It has great and the sealing potential and very small volumetric change upon the setting. It has increased the plasticity and slow setting time when it is due to the presence of sodium, the borate and hydrate. Disadvantages are the post-fill sensitivity due to overextension into the periapical tissue and may last longer due to its long setting time. Zinc oxide eugenol can be decomposed by water through continuous loss of eugenol, making zinc oxide eugenol a weak or unstable material. Manipulation: sterile glass lab and spatula, not more than 3 drops of liquid should be used at a time. Small increments of powder is added to the liquid and mixture, and the cement will be hardened on the 6 to 8 and left in the glass lab. Advantage: biocompatible, take 3 days to set, stable in nature, shows little water absorption, early disintegrates in the plant tissues. A disadvantage: extruded sealer is resistant to resorption by tissue fluid, shows minimal antimicrobial activity. Apoxide available in syringes and the composition base: calcium hydroxide 31.9%, zinc oxide 5.5%, silicon dioxide 8.1%, zinc stearate, hydrogen confinate, trilene, and polymethyl acids. The activator: trimethyl hexamethyl acrylate, bismuth carbonic basic, bismuth oxide, silicon oxide. Advantages: biocompatible, easy to mix, radio opaque, hot setting of the reagents. Iodoform, it is known as and released from the sealant introduced by Japanese sealers. Calcium hydroxide iodoform released from the regions. Concerns over calcium hydroxide based on current information in the literature can be concluded the term of leakage calcium hydroxide based on are not superior to other group of sealers. It has been the statistically insignificant association to the rapid healing of the apical periodontitis. The resin-based sealers, which includes polyvinyl resin base, which is diacid, and the which is a polyvinyl resin reinforces chelate formed of the regions. A powder 2.4 by ketane triethylene caporic acid copolymer, good aesthetic and the fast setting and the stable in nature, superior and the tensile strength advantage. Disadvantage include toxic in nature, tricky material, difficult to manipulate if extruded, fibrous encapsulation, set in adversely and affected by presence of and the phenol. Epoxy resin based sealers, powder liquid, bismuth oxide, hexamethyltoluene, silver powder, titanium liquid, bisphenol dye and the diketene properties, good flow, good adhesive properties, antibacterial, contact slightly well hardened, low toxicity and well tolerated. Advantage not affected by the moisture or well even set under the water, setting time 36 to 48 hours at body temperature, 5 to 7 days at room temperature, and the greater addition to the dentine, low solubility, tissue compatibility, slight shrinkage. Disadvantage slight containing formaldehyde release in AH plus is an epoxide amine resin pulp canal sealer developed from its predecessor AH26 because of the color and shade stability, and this is method of choice where the aesthetic demands are higher. This is easy to make sealers adapt closely to the wall of the prepared root canal and provide minimal and the shrinkage upon setting as well as outstanding the long-term dimension stability and sealing properties. AH plus, which includes epoxy resin sealers, endodontic grafting, non-instrument technology, method of root canal filling, and the principles of practices. To do those for the operating quality after the 4 years of storage using non-instrumentation technique. These are the references and which includes modular adaptation of new root canal sealers to the Dentine SEM study. The aim of the study was to assess the antimicrobial access of the comparison of various endodontic oversight of the regions in the United States, ISRO on the of the regions. Leakage continues to be the major reason for the failure of root canal therapy. Ideally, root canal filling material should be provided for the prevent of bacterial ingress into the oral cavity. In bacterial leakage tests, Epiphany and silicon were superior to gutta and various other treatments. Welter et al. Suggested the newly introduced calcium silicate based pro root sealer sealing quality, biocompatibility of the region, sealer extrusion. Many factors can increase the risk of the sealer extrusion. For example, over instrumentation, the complexity of anatomy of root canal system, and the excessive amount of sealer, excessive compaction forces, hydrostatic pressure, use of dentino spiral, immature canal apices, or root and the tip resorption. Most of the case reports suggested that the sealer extrusion, especially due to over instrumentation, are more likely to be the regions. Numerous clinicians have reported cases of several neurotic and the plant defects and the Spangman regions. And despite of claims of manufacture of the advantage of the region, flow should be and the adequate enough and the enough for the region. If there should be good bone strength when and the compared to the of the syllabus and reinforce the whole root canal system. Where adhesive filling it should be antibacterial property when compared to the of other sealers. If calis or calcium hydroxide by sealers, seal apex and apexes were ineffective. The zinc oxide based sealers and calcium hydroxide appear to have greater solubility than other sealers. Dimensional changes flowing set in the region. Here we conclude that even though there is a loss of advancement have taken place in the field of dental metals, an ideal sealer still remains a concept rather than the truth. But an experienced clinician should be able to select the sealer which suits the situation by careful evaluation of properties of biocompatibility, physical properties, ability to seal all the